Welcome to MicrObs, a dashboard enabling you to monitor the presence, spread, or resurgence of certain pathogenic viruses responsible for respiratory and viral gastrointestinal infections in Luxembourg's wastewater. Even though wastewater is not very appealing, it's a real goldmine of information because it reflects our state of health. Many infectious illnesses, like COVID-19, influenza, and some viral gastroenteritis, are caused by viruses found in wastewater. When you have one of these illnesses, you release millions of these viruses, which can then be detected in wastewater, even in very small quantities. Analyzing wastewater from a treatment plant is like taking a health snapshot of the community connected to that plant. In addition, this approach provides several benefits due to anonymous, non-invasive, and rapid data collection. Thanks to MicrObs, you can get a snapshot of the state of health of Luxembourg's population for certain key infectious illnesses. So, how does it work? The first step, of course, is to collect wastewater. Wastewater is collected at 13 strategically selected treatment plants, chosen to provide comprehensive coverage of the country's entire population. Sampling in these facilities may be switched to active or inactive, depending on the national epidemiological situation, to ensure efficient and effective surveillance. Wastewater is sampled once or twice a week, or more frequently during an epidemic peak. The samples are then sent to the laboratory for analysis. The water is very dirty and full of detritus. So first, we need to remove as much detritus as possible while preserving the integrity of the sample. Next, the viruses in the sample need to be concentrated. The ones we are looking for may be present in small quantities, depending on the epidemic period. This stage is essential for them to be detected. In fact, it's not the virus itself that's detected, but its genetic material. Virus particles therefore have to be broken down to extract their genetic material. Molecular techniques are used to specifically detect the pathogenic viruses of interest. The data is then interpreted, providing information on the pathogens circulating in the communities connected to the identified wastewater treatment plants. These findings are sent to the Ministry of Health, which uses them to support public health efforts. By analyzing these trends over time, the ministry can gain a clearer understanding of the virus's presence and spread in the community. At the same time, the data is also posted on this dashboard. By consulting it each week, you will be kept up to date on the circulation of viruses of interest among the Luxembourg population. But please be vigilant in your interpretations. An increase in the presence of a virus in wastewater over the course of 1 week doesn't necessarily mean the start of a new epidemic period. Numerous parameters need to be taken into account to interpret the graphs correctly. In addition to the actual values, shown as points, a curve showing the average of the last 3 samples is displayed. This curve can help you to identify general trends in the pathogens monitored, but it should still be interpreted with caution. So, are you curious to know what's in our wastewater? Go and explore MicrObs.